So here's how I draw up insulin in a syringe. Always check that you've got the right size. This one says 40 units at the top here per mil, and this is our insulin, so it has in fine letters there 40 units per mil. Now as you can see, there's a wee powder in the bottom, and that means that all the good stuff's at the bottom, so you need to mix it. I actually grab it like this and just rock it. So about 10 times or even more, just till that powder just gets evenly dispersed. I tend to not put my finger on the bung because that's where you're going to put your needle through, just in case you've got dirty fingers. So just mix it. You don't want to shake it because it's quite delicate and it's going to be destroyed if you shake it or drop it. It has to be kept in the fridge again, otherwise that will get destroyed. So we've mixed it pretty well now. We take the lid off our needle. You can see there's a little circle, so we're going to pop that in the middle of the circle, the needle. So we're going to pop the needle in the middle of the circle, and then we're going to draw up more than we need. So she's on 6 units, but we're just going to give her 5 today because her food's a wee bit less. Sometimes you'll get just a little bit of a bubble up there, so what we try and do is flick the needle to get the bubble up. It's better to have it more upright. And then just push up. We're going to give her 5, so it's the top of the plunger. Take that out. Pop the cap back on. Now I always put it away in the fridge now, otherwise if you leave it out, of course you're going to forget it. I usually put it in its box. Then I know it's all nice and clean. And that goes in its little special tray that I've got there. So then our syringe is ready. Often I've got my measured amount of food out ready as well. So then I take the food and the insulin to the dog. They do say not to get any bubbles in the syringe. It can be quite hard with these ones because of the straight across at the top to actually get rid of really small bubbles. So don't get too hung up on that. As long as you've got a sort of consistent same little bubble each time, it's all a matter of the dose being the same each time for your dog. So make sure there's no obvious bubbles and big bubbles, and as long as the dose is consistent, I wouldn't get too hung up about it. So that dose is ready for the dog.